Hey, good morning, and welcome to the January 2021 podcast. So, here we are again, doing another show for everybody, and hopefully some information that everybody can glean and use. Well, right off the bat, though, I want to tell you, go down to the bottom right there and click the subscribe button. That makes a big difference as far as you get notified as soon as I put out another podcast, because we're not putting newsletters out virtually every month, but we are trying to put a podcast out every month. So by clicking that subscribe button, that will let you know automatically an email that you have a new podcast to watch. Okay, and this is how we put our information out to our people. This is the new and modern way. The other thing is hopefully click the thumbs up button. Let me know you liked it or didn't like it. And like I said, by clicking the bell and subscribe, make sure that lets you know that a new podcast has come out. From the last podcast, you need to get your updates done. We just got a notification, and you should have gotten one too in your email from the Heart Association, that come February 1, they're going to cut you off if you didn't do the 2020 updates. So again, remember, you got to do the Heart Saver update, you got to do the Basic Life Support update. The Heart Saver update will do the CPR and the first aid. And like I said, the first aid is probably the most interesting because it's got a lot of the stop the bleed stuff that we've already been teaching. They've added that now to the first aid program, which is kind of neat. But you got to get that done. Please get that done and get that into Kathy so we can get your records updated, so we know you've been updated in case they can say to us, this person's been decertified. We can say, no, here's a copy of the thing. So again, make sure you get that to us. Came up in our most recent class today that people are saying that rescue breathing is no longer being taught. Well, that's not true, especially in your basic life support class. In your Heart Saver class, there really is no rescue breathing per se, because you're not going to know if they've got a pulse. Okay. However, basic life support, you're going to know that they've got a pulse, but not breathing, in which case you're going to rescue breathe them. Okay, so yeah, that is still part of the course. That is still being taught. How you practice that, we use the one-way valves and pocket masks, so that each person has their own mask, their own one-way valve, so they can demonstrate their rescue breathing on the mannequin. So again, there are ways to do this and do it safely. If they decide that they're, quote, not going to do this in the field, well, remember that a lot of the times when you're doing CPR, this could be a loved one. This could be a husband, wife, your child. So yeah, rescue breathing comes in really important. And let me bring up that a lot of your drug overdoses or what we used to refer to as huffing issues, when they're sniffing glue and stuff like that, they went into respiratory failure first. And they were in respiratory failure for a little bit before they ever went cardiac arrest. So recognize respiratory failure and giving them rescue breathing only. In many cases, that's all they needed to make the save. So yeah, rescue breathing is important. It's still being taught. And yes, it is part of the program. Okay? Getting a little upset with some of our instructors that are calling us, asking us, how do you get cards? Okay, these are instructors that have been around for a while. We have been using e-cards now for 3, going on 4 years. So yeah, how do you not know how to get cards? So yeah, that just kind of blows me away, because how are you getting cards and you don't know how to get cards? Okay, that's point 1. Point 2 is with our monitors. A lot of our monitors that we're doing right now are really going well. They're doing fantastic classes, and it's really a pleasure to watch that. Kind of neat to see them do their classes. But then we've got the instructors on the other hand that, to me, it sounds more like you're selling cards. Because if you can do a complete refresher in 30 minutes, something is wrong. You are not covering all the material. Okay, when I do a person one-on-one, just me, and it's an experienced person that I'm doing a refresher for, it takes me approximately 2 hours to do that refresher. Okay, that's literally hitting all the topics, going through all the practice, doing all the things to do for that person is roughly 2 hours. So no, you cannot do a refresher in 30 minutes. It doesn't happen like that. Okay, and when we see things like that, it really brings us to question, what have you been doing in the past when you're teaching? You know, if this class only lasts a couple minutes, then that means your classes are lasting a couple minutes. And that is not what we want for paramedical personnel in Maryland. we're known for our quality. You'll ask anybody out there and they'll say, if you really want to know how to do this correctly, go to paramedical personnel in Maryland. We appreciate that from the folks, and we believe in that. Okay, so yeah, this is not about selling cards. It's about making sure they understand what they're doing. I don't care how long they've had a previous CPR card. It's been my feelings, and certainly my experience, that a person that tells you that they don't see why they have to do this, they've done this for 80,000 years, and that's fine. Then show me your skills. And they're always the one that don't have a clue which end of the mannequin to blow in, but they're the ones that are going to give you the hardest time about doing their skills. Those that really are good at their skills have no problems demonstrating their skills. Okay, so keep that in mind. So I don't want to see classes running 10 seconds and the class is over, and I don't want to see things left out of your classes. If we have to get involved to keep fixing things, like put your hand below the xiphoid process, well, no, that's on their stomach, and that's not where the hands belong. So if we've got to correct errors like that, then that tells me you don't know what you're doing teaching this course. And remember that teaching has nothing to do with your experience. You could be the highest educated instructor we've got and don't know how to teach it. How many times when you've gone through college and those kind of things, have you had some professors that were absolutely fantastic? Man, they told you stuff and you just remembered it forever. And then you had the other ones that had all kind of degrees. They were certainly educated in their field, but they couldn't explain to you for 5 seconds how to even put 1 + 1 = 2. They just could not get that across. So not everybody really makes it as instructors. Not everybody is an instructor automatically. And then some people just have that gift that they can walk in a room, identify with the people, and teach a fantastic class. And they're the ones we want here in PPM. So please practice before you do our monitors. We're not trying to pull any punches. We're doing what's required. And so if you don't know how to teach the class, then please just go ahead and drop out of our training center now, because we really don't want people that don't know where to put hands on the chest of a patient slant mannequin out there teaching our classes. Okay, so that may sound a little harsh, but as you're doing these monitors, like I said, a good portion of them, these folks are really good. They do great classes, and I'm proud to say they're in our training center. But then we get the ones that really don't know what they're doing. And you wonder, who have they taught over that period of time that are not going to be able to do this correctly? Okay? So that's about it. I'll get off my soapbox here and stop ranting. But for those that are doing good jobs, and a lot of them are, thank you very much. Thank you for being part of our training center, and I care about you guys a lot. Follow-up Jackie is still doing fine. Seems to be completely back to normal. And so far, everybody else here, knock on wood, has done okay. Hopefully all you guys are still doing okay. And maybe many of you have gotten your shots already. We're slated to get our shots here coming up. We haven't been given dates yet. And now with the missing vaccines, we'll probably get put back even further. So hang in there. This will pass. And hopefully by 22 is my guess, we will really kind of be back to full normal. But 21 is still going to be a challenge for us. Okay, so again, if you've got questions or thoughts or comments, please let me know. Email me, let me know. Again, topics for our podcast, any topic that you want me to talk on, go ahead, let me know, and I'll add that to our next podcast. Okay, so again, stay safe, hang in there. This too shall pass.